first and foremost President Ursula von der Leyen for co-hosting this event. Many thanks to you all for your presence and for your excellent preparatory work. I should thank all the staff and the organization of the European Commission and of the Italy's government. They have done a fantastic job. I think we will renew our thanks at the end, and I'm pretty sure it will be double of what I can say now. The COVID-19 pandemic has shown the importance of international cooperation to address the current and the future health crisis, any future health crisis. This is why we have decided to prepare for this conference through a broad and inclusive process. This pre-summit will host contributions from scientists, medical practitioners, philanthropists and economists. We must look across countries and across disciplines if we are to understand what's gone wrong during this pandemic and what we can do better. Thanks to Global Citizen for organized Vax Live, the concept to reunite the world. This event has reached millions of people and has raised awareness on the main topic and aims of the global health science. It's been a great success. It has allowed to secure 26 million vaccine doses from governments, philanthropists and the private sector to donate to low and middle income countries, plus an additional $302 million for medical tools. As we prepare for the next pandemic, our priority must be to ensure that we all overcome the current one together. We must vaccinate the world and do it fast. I look forward to hearing your contributions. Thank you.
Thank you very much, Mario. Thank you very much, and thank you all for joining us today, and welcome to the Global Health Summit. We have been working on this summit for almost 9 months now, and many of you have been working with us even longer. Today, we will talk a lot about lessons learned throughout this pandemic. And the first lesson I learned was how much we need each other. How much people in government need to work with people like you, scientists, experts, health workers, pharmaceutical companies, foundations, and of course civil society organizations, all caring about global health. I shall never forget how much the scientific community has helped us in the toughest moments of the pandemic. If today we have hope, it's thanks to the women and men who have dedicated their lives to science, a career of hard work and very often little recognition. We really owe you. And I'm glad that you have guided us on the road leading to this Rome summit. I would also like to thank the global health partners and civil society representatives for walking alongside us. Today, we will discuss how to provide sustainable financing for healthcare and preparedness. And this year, civil society has helped us fill the funding gap and advance the global vaccination campaign. For example, through global broadcasting events like Vax Live, organized by Global Citizen. So thank you for this. We are also here because we have been inspired and motivated by you. The logic behind this summit is to turn the experience of this year into sustainable solutions for the future. So I would like to kick off by announcing a new Global Health Policy Forum. It will be an annual high-level event bringing together global health partners in policy dialogues so that your voice and your experience can continue guiding and inspiring us. Before I finish, I want to say a word about the tireless health professionals and frontline workers. And I'm glad that one of you is with us today. I know a lot of it because I'm by training a medical doctor, but today I would like to speak as a member of the public. And I would like to thank you. You have worked in the most impossible conditions. You have saved countless lives. And even when there was nothing you could do, you gave your everything. And you tried to alleviate your patients' suffering. This summit is also for you. And in the Rome Declaration, we will all commit to investing in our most important health infrastructure, that is, our health professionals and community workers. Today, we will focus on 3 goals. First, bringing this pandemic under control everywhere. Second, making sure that vaccines reach everybody everywhere, not only through sharing and export, but also by spreading manufacturing capacities to more regions. And in this context, Team Europe aims at donating at least 100 million doses to low and middle income countries by the end of 2021. And third, preparing for crisis. So I'm glad to have all of you here. I look forward to hearing your ideas, and we will take them forward into the summit discussions this afternoon. And Mario, I have the pleasure to announce the first speakers today. So the first speakers are Professor Peter Piot, Professor Silvio Brusaferro, Professor Victor Zhao, Professor Yi-Sin Liu, and Professor John Nkenga Song. So, dear professors, I am eager to hear you have chaired the high-level scientific panel. You gave us the scientific input to our Global Health Summit. I have read your report with great interest. It is proof of the importance of independent scientific advice. Please, the floor is yours.
Dear Prime Minister Draghi, dear President von der Leyen, Your Excellencies, thank you very much for your leadership hosting this important summit and for the invitation for the scientific expert panel co-chairs to join you here today. We are delighted to present the key findings of the panel's report, which is the outcome of scientific collaboration between 26 eminent independent experts from around the world. The scientific consensus is clear. The pandemic is far from over. The virus will likely become endemic, and the situation is currently worsening in many regions. Now more than ever, we must rely on science to end the acute stage of the pandemic, and at the same time adopt a long-term view, paving the way for better preparedness and response when the next health threat inevitably strikes. Now, if there is a silver lining in this crisis, it is international scientific collaboration, which gave us vaccines. And the growing availability of safe and effective vaccines now gives hope for bringing the pandemic under control with very low mortality. But the top priority is to ensure global vaccine equity immediately. And we call on leaders to step up funding, the ACT Accelerator and COVAX, and on high-income countries to share large numbers of vaccines. This is not only a moral imperative, but critical for pandemic control. No country is safe until all countries are safe.
The rapid scientific breakthroughs in this pandemic have been truly remarkable. We must now seize the momentum to ensure research and innovation is the driving force behind our emergence from the pandemic to a healthier, safer, and more equitable world. Our recommendation is clear. Invest in scientific research before, during, and in between health crises. We need an efficient and effective end-to-end research and innovation ecosystem of global entities with suitable mandate, financing arrangement, and ability to coordinate multiple actors to optimize global R&D efforts. In our report, we outline a range of priority areas in basic, clinical, and digital sciences and urge leaders to take immediate action to increase investment, develop, optimize, and better coordinate these priorities at the global level. Crucially, we must actively and genuinely involve research groups in all countries, especially low and middle income countries, to benefit from their diverse experiences and to ensure scientific outputs are relevant and accessible in the countries in which they will be implemented. It is only through these joint actions of excellent science, truly international collaboration, and sustainable financing that we can chart a path out of the present crisis and tackle many other global threats in the future as we face. Thank you.
The scientific community saw this pandemic coming. We raised alarm bells, but the global community failed to listen and to act. Now our message is simple. Strengthen and protect science advice. We must ensure the independence of government advisory bodies, empower public health institutions, and safeguard against the politicization of science. We need open dialogue between scientists, politicians, and the public. We are also facing a now or never moment. We call on leaders to strengthen regional manufacturing capacities by funding and establishing a network of ever-warm regional manufacturing hubs for vaccines and biologics that are flexible, mitigate geopolitical supply risks, and are sustainable in non-pandemic times. Scarcity is the enemy of equity. This is crucial not only to advance equitable access to COVID-19 vaccines, but to strengthen our collective health security in the future.
COVID-19 underlined the critical need for early and reliable information to react swiftly and effectively. We need strengthened, integrated disease surveillance, data collections, analysis, and sharing. It is only by coordinating and collaborating at all levels and across all sectors, disciplines, and countries that we can prevent the next outbreak from spiraling into a global emergency. Crucially, these collaborations must include empowering and earning the trust of people and advancing equity as a central principle. Communities must be involved every step of the way. People's trust is earned over time through empowerment and involvement of citizens. We must also counter the virus spreads of misinformation and rumors, an infodemic that has undermined citizens' trust in public health measures and jeopardized their effectiveness. We have to invest in effective risk communication.
National COVID-19 responses have been very unequal. At the heart of successful responses is a combination of strong existing system for a whole of governments, coordination, and political leadership at the highest level, making early evidence-informed decisions. We call for immediate investments in standing systems and workforce for preparedness and response. We must boost public health capacities, including a well-supported and well-trained workforce. We also urge leaders to strengthen relevant governance structure and leadership and ensure adequate financing, including a mechanism for multi-sectoral coordination. Finally, let us address the problem at the root. To reduce the risk of future pandemics, we must address links between health crisis, poverty, structural inequalities, and environmental degradation. The frequency and nature of future epidemics strongly depends on our ability to adopt more sustainable ways of living, including the implementation of the Sustainable Development Goals and One Health approaches. To conclude, leaders and societies must act now to end the acute pandemic. Investments today will also build the foundation for stronger preparedness and response tomorrow. This unprecedented crisis demands an unprecedented response. Thank you.
Yes, thank you. Thank you. The next speaker is Professor Elizabeth Adams. She is president of the European Federation of Nurses Association. Dear Elizabeth, you represent 3 million nurses working in the European Union. This has been a very challenging period for them, for you, and for your colleagues throughout the world. Please tell us what they are telling you, and we tell you thank you.
Good day, G20 delegates and guests. My name is Elizabeth Adams. As President of the European Federation of Nurses, representing 3 million nurses, I wish to thank Prime Minister Draghi and President von der Leyen for the opportunity to present a few short remarks that I hope will enrich your consideration in relation to the Rome Declaration principles. COVID-19 is an ongoing challenge to an already fragile health system. We all witness the devastation of individuals and their families, with some health systems being overwhelmed, inequality of access to care, equipment, vaccines and other infrastructure challenges, including the stark digital divide between countries and within countries. EFN, supported by the European Commission funding, is privileged to work on a number of electronic health records and other digital artificial intelligence and digital solution projects. As the largest health professional workforce in many countries, nurses provide round-the-clock care. Nearly every citizen at some point in their life will benefit from the expertise and care of a nurse. Millions of nurses worldwide experience high exposures to COVID-19, with reports of up to 30% of nurses in some countries contracting COVID, and many more experience exposure with career-ending consequences. Prior to the pandemic, the World Health Organization estimated a shortage of approximately 10 million nurses by 2030, which could rise to 14 million. Well-prepared and educated nurses equate to lower patient mortality rates and better patient outcomes. Therefore, investing in nursing and strategies for the recruitment and retention of a vital pillar to ensuring the building of healthier, safer, fairer, resilient and more sustainable health systems with capacity for any unexpected crisis that will protect the G20 pillars, the people, the planet, the prosperity of our world. As our political and global leaders, you witness the brave, heroic, compassionate commitment of nurses who cared for the most vulnerable, preserve millions of lives on a daily basis and provide comfort and dignified care at the end of life. I know the admiration you have for the nursing profession. The greatest recognition you can afford to nurses is to incorporate their problem-solving expertise into the co-creation and co-design of policy as end users who will translate that policy into practice. Finally, investing in nursing is a certain investment in the health of G20 nations and people around the planet. Every good wish for your important work at the G20 summit. Grazie and thank you.
Thank you very much, Elizabeth. Now, the next speaker is Stefania Burbo. Dear Stefania, I'm so happy that civil society has been a key stakeholder in the preparation of this summit. Please, you have the floor. We're listening to you.
President Draghi, President von der Leyen, global leaders, I'm speaking on behalf of the C20, the G20 engagement group gathering more than 500 civil society organizations and communities worldwide. They are looking to you to tackle emergencies as well as address the roots of the current crisis through systemic reforms. We expect you today to agree on global health solidarity, which goes beyond global health security and is based on human rights and gender equality, that should be clearly included in the Rome Declaration. To support global health solidarity, we call for a multilateral health architecture with a fully funded, independent and effective WHO at its center. We need the government's commitment to invest in trained health workforce, including community health workers. This is necessary for quality public health systems responding to health emergencies while continuing to deliver equitable access to essential nutrition and health services, including sexual and reproductive services, and with the gender medicine approach. One Health should be understood as the best approach to prevention, early detection and surveillance of future pandemics. As we are still grappling with COVID-19, we call global leaders to use all the complementary initiatives to expand the supply of COVID-19 tools, as the ACT, the CTAP and the TRIPS waiver for vaccines and technology transfer during the pandemic. They should also support the research for heat-stable vaccines that can be used anywhere. The increase of the fiscal space and debt cancellation of fragile countries are fast ways to free up resources to tackle COVID-19 and redirect them to strengthen health systems. When identifying gaps in pandemic prevention, the impact of COVID-19 on programs for chronic diseases such as HIV, TB and malaria has to be considered. Health mechanisms as Gavi, the Global Fund and UNITAID have to be fully supported to fulfill their mandates. Last but not least, we recommend clearly reflect in the Rome Declaration the meaningful participation of communities, civil society and women in the political, decision-making, implementation and monitoring process in achieving universal health coverage. And we call for a transparent, meaningful and inclusive involvement of communities and civil society beyond the Global Health Summit. Thank you for your attention.
Thank you. The next speakers are Helen Clark and Helen Johnson-Sirleaf, co-chairs of the Independent Panel for Pandemic Preparedness and Response. Dear Helen and dear Ellen, I want to congratulate you on your report about the World Health Organization and lessons we have learned. You have the floor.
The Independent Panel's recommendations for a reset of the international system for pandemic preparedness and response flow from our diagnosis of what went wrong. If our recommendations are implemented as a complete package, we think the world could avoid the next outbreak of a disease with pandemic potential becoming a global crisis. The World Health Organization is at the very heart of the global health system, and its staff have worked so hard to deliver technical support and guidance to countries as the pandemic has raged. But WHO has long been underpowered and underfunded by its member states. It needs more powers to investigate pathogens with pandemic potential, to have rapid access to locations, and to be able to publish information about its findings. Currently, it must seek approval from governments to do even that. WHO's financial independence needs to be strengthened based on fully unearmarked contributions. Member state fees should be increased to cover 2/3 of its base program, with an organised replenishment process covering the rest. The terms of office for the Director General and for the regional directors should each be limited to one non-renewable term of 7 years. The cost to human life of the failure to invest adequately in pandemic preparedness and response is tragically evident today. Yet, such investment is a global public good. Our panel, therefore, recommends a new financing modality based on ability to pay, which would finance ongoing preparedness and have a surge capacity in times of crisis. This can't happen without the financial firepower of the G20 economies, and we hope the G20 finance ministers can help make this a reality. It may cost billions, but in the end, it saves trillions. COVID-19 demonstrates that pandemics have impacts well beyond the health sector. They from the national to the global. We propose, therefore, creating a Global Health Threats Council at the level of heads of state and government to maintain and mobilise political commitment to preparedness and response on an ongoing basis. We recommend that it be established by the UN General Assembly to give it the maximum possible legitimacy. Our panel supports the negotiation of a pandemic framework convention. It should fill gaps in the current international legal system and clarify responsibilities between states and international organisations. Our recommendations are presented as a package. Getting it implemented needs political will and leadership. That's why we call for a special session of the UN General Assembly later this year at leader level. Agree on a political declaration which would set out a roadmap to transform the system for pandemic preparedness and response. To the leaders of the G20 and the European Commission, we say this. The panel has provided a solid analysis of what made an outbreak into a pandemic. Its recommendations, if implemented, will contribute to ending this pandemic and to being prepared for and responding to future pandemic threats. We therefore seek the support of the G20 and the European Commission for taking this reform package ahead. Your support now will make a difference for now and for the future.
Your Excellencies, distinguished delegates, Prime Minister Clark and I are most grateful for the opportunity to address the G20 Global Health Summit. The Independent Panel for Pandemic Preparedness and Response presented its report last week. We said that the outbreak of COVID-19 became a pandemic because of a myriad of failures, gaps, and delays in preparedness and response. Pandemics are an existential threat to humanity and to economies. The G20 has in the past delivered decisive action to tackle financial crisis. Given the up to $22 trillion impact of this pandemic by 2025, we need the G20 to back pandemic preparedness and response, becoming a top global priority. And we need leaders to continue to engage on that now and for the long term. The situation we find ourselves in today has been compounded by geopolitical tensions and nationalism, which have weakened the multilateral system, which was designed to keep the world safe. Leaders must lead to fix that. Those gathered at this summit can set the example, can show the leadership necessary to ensure that this is the last pandemic to cause the devastation that we are witnessing around us today. First, we call for immediate actions to stop the current pandemic. The vaccine coverage map today is a glaring picture of inequity. We ask for at least 1 billion doses by the 1st September to be committed to the 92 low and middle income countries of the Gavi COVAX advanced market. We need this commitment from those of you who are already on the path to adequate vaccine coverage nationally. You have surplus vaccines ordered and are in the position to share. Second, we know that currently demand for vaccine outstrips supply. Even if all the existing doses are redistributed, that won't be enough. Manufacturing capacity must be rapidly expanded, supported by agreements for voluntary licensing and knowledge and technology transfer agreements. If that doesn't happen in the next 3 months, a waiver on a TRIPS should come into force with immediate effect. The major vaccine-producing countries among you have the power to make that happen. Your support will move the needle. Third, the Access to COVID Tools Accelerator Act A faces a $19 billion funding gap. As the grouping of the world's largest economies, you can close this gap. This must not be seen as an act of charity, but rather as a necessary step to ensure a safer world for all. Many of you here today were involved in establishing Act A. We hope that you will support it evolving into a standing platform for the development and delivery of vaccines, diagnostics, and therapeutics based on a global public goods approach. We understand that full funding of Act A is being considered by the G20. This is an essential contribution to ending the pandemic. Thank you again for this opportunity. And I now hand over to my co-chair, Prime Minister Clark.
Thank you so much. Thank you, Ellen and Helen. Now, the next speakers are Senior Minister Tharman Shanmugaratnam and Professor Lawrence Summers, the co-chairs of the G20 High-Level Independent Panel on Financing the Global Commons for Pandemic Preparedness and Response. So, dear Tharman and Larry, sustainable financing is crucial to avoiding the cycle of panic and neglect. You will soon publish a report on this, so please share with us some preliminary findings, and you have the floor.
We know we're nowhere near the end of today's pandemic, but we must also know that we're nowhere near having a system that will prevent a repeat of a pandemic of this scale, a repeat of the large-scale collective failure of the last year. It's not that we lack the resources. We do have the resources, scientific, technological, financial. Our critical responsibility is to mobilize and organize those resources better, and in particular, to be able to distribute them globally at speed and at scale. The work of the G20 panel that I co-chair with Ngozi Okonjo-Iweala and Lawrence Summers is still underway, but our recommendations will be founded on 3 indisputable facts. First, preventing a pandemic is about global public goods. It's not about aid. It's not just about equity. It's about every nation, rich and poor, benefiting when every other nation is equipped. And 2 things flow from this. First, multilateral financing has to be at the core of the system, not just discretionary or bilateral financing. And second, there has to be a heavy grant element in this financing system, particularly for the low-income countries, to be able to invest in global public goods. Second, incontrovertible fact is that the costs of investing upstream to prevent a pandemic are infinitesimal compared to the costs of failing to invest. So we have to take very seriously putting in place a surveillance and alert system globally, regionally, and nationally, and take very seriously the strengthening of national healthcare systems, which are still the key defense against an outbreak becoming an epidemic and becoming a pandemic. Third fact, once we are in a pandemic, speed and scale are everything. And that means we have to prepare well in advance of a pandemic. In particular, we do need substantially larger manufacturing capacity to be able to equip the world when a pandemic hits. And it has to be put in place well before a pandemic. It requires public sector participation to incentivize the private sector to invest ahead of peak demand in a pandemic in PPEs, vaccines, testing instruments, the lot. It requires public sector participation. Finally, I would have to say that the status quo in global governance will not prevent the next pandemic or the colossal costs that it's brought. We do have to use existing institutions, not create new ones, but we have to use them better. They have to work tightly together, the WHO, the international financial institutions, the various healthcare intermediaries, and work together with the private sector and the philanthropies as well. Work nimbly, work swiftly, and work with country authorities to detect outbreaks early and to respond much faster when pandemics hit. We can do better, and we must.
Our panel was formed because of a general recognition that COVID-19 was the most serious global security issue that the world had faced since the Second World War. One looks at the tens of trillions of dollars of lost output, the millions of lives that have been lost. This is an enormous risk. Our first question was that COVID-19 was not an extraordinary event. It was not a once-a-century event. It was not an event that should have been a great surprise. Indeed, we estimate that a COVID-like threat is likely to face the global system every decade going forward. And we were clear that the current arrangements produced an unacceptably poor outcome with respect to COVID-19, and if maintained, could put us at risk of an even worse outcome in the future. The question is, what needs to be done? That, we conclude, is a story of mobilizing finance to prevent future problems, mobilizing finance to contain future problems, and assuring that there is not just money, but there's governance and incentives that ensure that that money will be used well and that resources will be available even after COVID-19 recedes from memory. We've benefited enormously from consulting with a wide range of stakeholders and a wide range of actors in the current battle. Our broad conclusions are that there needs to be a substantial increase in resources, that an absolutely critical role can be played by international financial institutions, but that will require very substantial adaptation by those institutions, and that we will need new, though not necessarily rigid or formal, structures of governance to assure that resources are maintained, are adequately and are used well, both to prevent pandemics and respond to what comes.
The next speakers are Professor Thomas Mettenleiter, and Professor Wanda Marcotter, co-chairs of the One Health high-level expert panel. Dear Wanda and Thomas, One Health is a fundamental principle of the Rome Declaration. That means looking after not only human health, but also the relationship with animal and environmental health. Please, you have the floor.
As one of the two founding, great pleasure and privilege to inform you about the establishment of the One Health high-level expert panel, whose inauguration session has taken place on Monday, May 17th. This panel is the result of an agreement between WHO, OIE, FAO, and UNEP, recognizing the need for a global center of expertise to connect and communicate on issues related to One Health, the interaction between human, animal, and environmental health. The current pandemic has shown it clearly that One Health approaches are required not only to analyze and understand the emergence of novel threats by pathogens, resulting in devastating global crises such as the SARS-CoV-2 pandemic, but primarily to be better prepared to counter, control, or at best prevent the next pandemic situation. Thus, the panel is expected to provide guidance on One Health-related matters that support improved cooperation among governments, support the work performed by the partners in the framework of the One Health collaboration, and executes an advisory role to the partners. The recommendations of the panel will be based on scientific evidence to be reviewed by the panel members. The 26 panel members have been selected from more than 700 applicants by the 4 mother organizations, representing a broad base of expertise. 1 week after the notification of appointment, the first session of the panel was scheduled, so we are getting started as rapidly as possible. I now hand over to my colleague, Professor Wanda Marcotter, the founding co-chair. Wanda.
Your Excellency, ladies and gentlemen, it's an absolute pleasure to address you as the co-chair of the newly established OLED panel. We already had our first meeting on 17 May, and the panel is represented by all expertise needed for a One Health approach globally. It includes representation from the environment and social sciences. As a start, we aim to document and analyze One Health approaches to really understand what has been successful and what not to do in the future. Where are the bottlenecks? What do we really know on the ground? And identify the gaps and how we can go forward and go forward practically. This expert advice will be shared with the partners so that they can use that strategically going forward. It will also maximize the use of resources if we stop working in silos and instead work together between sectors and disciplines to address the same problems. The One Health approach, stating that human, animal, and environmental health are linked, is not new, but it is now even more urgent to translate into action. It must change people's lives. Discussions, recommendations, and actions amid this pandemic, but also going forward and thinking about preparedness, must address this as one concept, with each aspect equally important. It is not just about pandemic preparedness, but it is much more far-reaching. It will create a healthier ecosystem for all, addressing several other concerns like biodiversity loss, climate change, food security, and social inequalities. So there are advantages in using this approach to prevent future pandemics, but even more so for overall improvement of health and for all, to be available for all, and sustainable economic stability and resilience.
Thank you so much. Now the next speaker is Professor Mario Monti, Chair of the Pan-European Commission on Health and Sustainable Development. So, dear Mario, your commission calls for a global health board taking sustained high-level political responsibility. I think this is a good idea, which I hope the G20 will take forward. Now the floor is yours.
Madam President, Mr. Prime Minister, thank you for inviting me to deliver a message on behalf of the Pan-European Commission on Health and Sustainable Development. This independent commission, convened by the WHO, will present its final report in September. It may provide useful inputs for consideration by the joint meeting in October of the G20 health and finance ministers, because our focus, not confined to pandemics, is more broadly how should health policies and economic and financial policies be better integrated in a holistic approach at the national and global level. Also to avoid that an insufficient attention to health policy may fire back and make economic and financial policies hostage of a health crisis. In a call to action that we published in March, we put forward a few recommendations on how to improve the international governance of health. In this G20 context, let me refer to just one of those. We are confident that under the leadership of Prime Minister Draghi and President von der Leyen, the Global Health Summit, which is about to begin, will adopt a number of important principles. But the implementation of such principles will need the very strong commitment of a strengthened WHO at the center of a wide network of health organizations and stakeholders. But the family of health will need, on this particular occasion and in the future, of a very strong, probably unprecedented political commitment and massive investments. So at the global level, a forum for the generation of this momentum needs to be identified to facilitate the provision of this political and financial impulsion. The Rome Declaration will probably call for a high-level political leadership structure. Well, without creating new institutions, such forum could be easily activated at the G20. The G20, perhaps in a more inclusive configuration, should consider setting up a global health board, building on the successful experience of the Financial Stability Board just after the huge financial crisis of 2008 with the appropriate adjustments. In this way, I am confident the G20 could give on a permanent base a unique contribution to global health. Thank you very much.
Thank you, Mario. The next speaker is Sir Patrick Vallance, UK Government Chief Scientific Advisor and Chair of the Pandemic Preparedness Partnership. Dear Patrick, ensuring follow-up of the Rome Declaration will be crucial. The UK holds the G7 presidency and is working as hard as and in collaboration with the G20 on pandemic preparedness. You have the floor.
My name is Patrick Vallance. I'm the UK Government Chief Scientific Advisor. I want to talk to you about a pandemic preparedness partnership for vaccines, therapeutics and diagnostics that we've been working up to take to the G7 as a roadmap. And of course, it links very closely to both the IPPPR report and the work done in the G20. It is about trying to set an ambitious target for getting vaccines, therapeutics and diagnostics ready within 100 days of a pandemic being declared. It's been developed in consultation with industry, academia, and of course many of the groups represented at the summit today. It's ambitious, but it's also possible. It requires certain things to happen. It requires an arsenal to be prepared during normal times. It requires rules of the road to be in place so we're not inventing them during a pandemic. And it requires many of the things that are exceptional during a pandemic to become routine in between times. If I take the three areas, for diagnostics, we think that the regulatory system needs to be much more straightforward, much more geared towards quality and use. And there needs to be a pull on diagnostics during normal times, in part through the surveillance system, which you're going to hear about from Jeremy Farrar later on. it needs that pull to be there all the time. For therapeutics, there need to be prototype molecules developed by industry and academia during normal times based on the priority pathogen list from WHO and CEPI. They need to be ready to go into the clinic, and clinical trials need to be at scale, not fragmented, not hundreds or thousands of small studies, but big studies across a network of trials with simplified rules put in place and used at all times, ready to be activated during a pandemic. And for vaccines, we need prototype vaccines present, based again on that pathogen priority list, ready to go, and simplified manufacturing, modular simplified manufacturing that allows ease of tech transfer across a network of vaccine manufacturing, private and public, that needs to be in place, ready to move things quickly. All of this needs to be underpinned by the three things of an arsenal being ready in advance, about the exceptional becoming routine, so embed it in practice at all times, and the rules of the road being clear, so you're not inventing them during a pandemic. I hope this will be endorsed by the G7 and can be taken forward through many of the groups here.
Thank you very much. Very interesting. Now, the next speaker is Bill Gates, co-chair of the Bill and Melinda Gates Foundation. Dear Bill, the Foundation's role as a supporter and advocate for global health cooperation is well known. So we are looking forward now to hearing your views. You have the floor.
Your Excellencies, European Commission President Ursula von der Leyen, President of the Council of Ministers Mario Draghi, thank you for inviting me to join this important meeting. We are now more than a year into the pandemic. While amazing scientific advances have delivered vaccines quicker than ever, the task now is to ensure everyone can benefit from them. Many countries have made generous financial contributions and commitments to donate doses to support the critical efforts by the ACT Accelerator and its partners to deliver vaccines, diagnostics, PPE, and treatments. But this still has not been enough to bring COVID-19 under control. Even as the United States and Europe seem to be turning the corner, other countries are experiencing their highest peaks. If current trends continue, we will see continued devastating loss of life. It's great to see the G20's commitment to advancing an equitable response to the pandemic. Now is the time for global leadership, solidarity, and responsibility. We must ensure more equitable access to vaccines. More than 80% of million shots went to people in wealthy countries. Only 0.2% went to low-income nations. If we do not close this immense gap, more people will die needlessly. There are two immediate actions countries can take: share dollars and doses. We need governments to contribute their fair share to ACT agencies and fill the financing gap in 2021. Also, high-income countries have reserved more vaccines than need. Without compromising their own domestic vaccination efforts, these countries can be part of an effort to accelerate global vaccine access by sharing these excess doses. I encourage nations to be bold and commit as soon as possible to sharing over 1 billion doses in 2021 through the Gavi COVAX AMC. Finally, this pandemic has taught us that we need to be better prepared for the next one. The Rome Declaration will lay the groundwork for better preparedness in the future, as well as concerted efforts to speed up the research, development, and deployment of vaccines and other tools. We need measures such as more integrated surveillance systems, rapid vaccine manufacturing, resilient health systems, sustainable financing. I hope the Rome Declaration that will be agreed today will provide a set of principles and actions to support pandemic preparedness, which will guide future discussions in the World Health Assembly and the G7 and G20 leaders' summits later this year. I also hope today's discussion will advance the global community's efforts to end this pandemic the only way we can, equitably. Thank you. Your Excellency.
Thank you, Bill. The next are Stella Kyriakides, Health and Food Safety Commissioner, and Paolo Gentiloni, Economic Commissioner, Janez Lenarcic, Crisis Management Commissioner, and Jutta Urpilainen, International Partnership Commissioner. Please, Commissioner Stella, Paolo, Janez, and Jutta, you have the floor.
The COVID-19 pandemic has shaken the whole world and has sent us clear messages. It has shown us the strength of global cooperation and that no one is safe until everyone is safe. With the WHO, we built the global framework to accelerate the development of COVID-19 vaccines, treatments and tests, the ACT Accelerator. The EU has invested €4 billion in research and in the production capacity of vaccines, now being delivered not just to the EU, but to countries all over the world.
The COVID-19 pandemic represents a shock of historic proportions for our economies here in Europe. But we are not forgetting those hit hardest. The EU, through the G20, has been supporting efforts to provide developing countries additional fiscal space and debt relief so that they can spend on health and social protection, including to buy vaccines. The world cannot afford that the COVID-19 crisis also turns into a debt crisis for many developing countries.
And we have not forgotten the most vulnerable in hard-to-reach or conflict-affected areas, where COVID-19 further aggravated their already dire situation. The EU's humanitarian air bridge has been instrumental to bring over 1,150 tons of vital medical supplies to the most fragile communities in 20 countries all over the world. The EU Civil Protection Mechanism has also been key to facilitate logistical support of vital medical supplies donated by our member states, most recently oxygen cylinders and ventilators to India, but also vaccines to our partners. We will further support with €100 million the rollout of vaccination campaigns in several African countries with fragile health systems and humanitarian settings.
We are determined to fight the virus beyond EU borders. Team Europe has mobilized over €40 million to help our partners address the pandemic. But people need vaccines now. Half of the 400 million doses produced in the EU has been shipped to our partners. Through an almost €2.5 billion investment in COVAX, Team Europe is leading efforts to share vaccines around the world. More doses will follow with the EU vaccine sharing mechanism. But our commitment goes beyond emergency measures. We must make sure this is the last pandemic we face. We are working hard to help partners better prepare for the future global health threats to prevent crises with investment in health systems strengthening. Team Europe is also developing an initiative with African partners to boost pharmaceutical capacity in Africa. Because in the end, there is only one race, the one against the virus, and we will only stop it together.
Thank you very much, Commissioners. It's good to listen to you. Now, our next speaker is Hugh Evans, co-founder and CEO of Global Citizen. Dear Hugh, we have worked together closely with Global Citizen since the beginning of the pandemic, and with the Vax Live event reached out to a global community on the importance of vaccination. Thank you for that, and now please share your thoughts with us.
Good afternoon, Your Excellencies. Just 2 weeks ago in Los Angeles, 20,000 fully vaccinated frontline community healthcare workers came together for Vax Live, the concert to reunite the world. The first large-scale event with an audience since March of 2020. This was only possible because of vaccines, because every citizen is aware of how their own behavior can protect others, and because frontline healthcare workers never gave up. And while here in the US we have a successful rollout model, over 80% of all vaccines administered have been administered in just wealthy nations, and just 0.4% have gone to the poorest nations. This is morally unacceptable, and we have the means to do otherwise. Simply put, we need you to urgently support 3 things: doses, funding, and knowledge sharing and technology. First, on doses. We're immensely grateful for the countries that have pledged to share vaccine doses like the US, France, Norway, Spain, New Zealand, Portugal, Sweden, and Croatia. But the poorest countries need many more, and they need them to be shared now, not later. The message that our members have said resoundingly is donate doses immediately. Vague promises about donating when 100% of your population is vaccinated is not good enough. Timid half measures won't end this pandemic. But the good news is people support you. In the UK, for example, 85% of the population is supportive of dose sharing. We call on the G7, especially the UK as the chair of the G7 in 2021, to significantly increase dose sharing through COVAX, beginning now, not later. And secondly, on funding. We need you to fully fund the ACT Accelerator, because after a full year, it's only halfway there. Just 2 G7 countries have given their fair share, Germany and Canada, while France, Italy, Japan are only about 15% of the way there. We need all wealthy nations to step up and do their part. This is not a budgetary question nor a question of charity. This is a question of political will. And if the staggering human cost of the pandemic is not enough for you, the enormous global economic cost should be. And finally, on sharing knowledge and technology, the gap between the haves and have-nots in terms of production and distribution of vaccines is a massive injustice, and it hurts everyone. With global supply under the control of a handful of pharmaceutical companies who monopolize the technology and have profit aims, millions of lives in the global economy hang in the balance. These companies can decide who to make agreements with and on what terms, like the mRNA vaccine manufacturers who've only made insufficient backloaded deals with COVAX. We need the G20, particularly those. And we need you to support all possible measures that can help increase global vaccine production and ultimately access, including sharing of intellectual property, technology, and know-how. We very much support the Spanish proposal and the American support of the temporary suspension of IP. Now others must follow. Your Excellencies, global citizens are counting on you. You have a unique opportunity at the Global Health Summit to agree upon a roadmap that will lead us out of this pandemic and set an example for the future. Please don't wait another minute to take bold action. Thank you.
Thanks, Hugh. The next speaker is the Chairman and Chief Executive Officer of Pfizer, Albert Bourla. Dear Albert, I'm eager to hear what further steps you and your other colleagues are taking to help us bring the pandemic to an end for everyone and everywhere. Thank you.
On behalf of all employees from Pfizer and our partner BioNTech, I would like to thank you for the invitation to speak today. It is an honor to participate in this summit. A global pandemic requires global solutions, which is why I'm so grateful for the opportunity to address this gathering of global leaders. COVID-19 has been one of the most challenging and devastating health crises the world has ever faced. But along the way, we have seen human ingenuity solve problems that we hadn't even pondered just 14 months ago. We also have seen unprecedented collaboration both across the pharmaceutical industry and between the private private and public sector. From the very beginning, we have been in this together. Pfizer has done our part by delivering in less than a year a breakthrough COVID-19 vaccine that has demonstrated an outstanding efficacy and safety profile. Recent real-world data from Israel, a country with a population 50 times smaller than the EU, suggests that their vaccination program with the Pfizer-BioNTech vaccine in its first 112 days prevented approximately 159,000 infections, 25,000 hospitalizations, and 5,500 deaths. While caution should be used in extrapolating to other countries, these observational findings are demonstrating the impact we can have in reducing human pain and makes all of us at Pfizer and BioNTech so proud. But the discovery of such powerful medical tools brought clearly to the forefront the question of equitable access and further highlighted the need to ensure access for everyone. First, because this is the right thing to do, but also because in a pandemic, everyone is only as protected as his neighbor. For this reason, fair and equitable distribution was our North Star from day one. To ensure that every country can have access to our COVID-19 vaccine, two conditions had to be met: a price that everyone can afford and reliable manufacturing of enough vaccine for all. The first condition was met early on. Last June, we decided to offer our vaccine through tiered pricing. This meant wealthier nations will pay about the cost of a takeaway meal for each dose. But middle-income countries would pay roughly half of that price. And low-income countries, we were offering the doses at cost. We took this approach because we believe that equity doesn't mean we give everyone the same. It means we give more to those that need more. Meeting the second condition has been more challenging, but we are getting there with remarkable speed. Thanks to our scientific skills, the dedication of our people, and significant investments, today, Pfizer and BioNTech are pledging to provide 2 billion doses of our COVID-19 vaccine to middle and low-income countries over the next 18 months. We expect to provide 1 billion of these doses to low and middle-income countries this year, and we pledge to deliver another 1 billion doses to these countries in 2022. It is our hope that this will accelerate our ability to help save even more lives across the globe. Ending the pandemic and vaccinating the world is a massive but achievable undertaking. And I want to thank the European leaders attending this summit and all leaders around the world who have joined us in this monumental and most important effort. The urgency you helped bring to the regulatory process, the infrastructure you have put in place to get shots into the arms of your citizens, the education campaigns you have funded to address vaccine hesitancy, all have helped us get several steps closer to ending this global health crisis. Special thanks to President Ursula von der Leyen for her leadership and partnership in Europe. I'm confident that together we will put an end to this deadly pandemic and enable science to win the battle against future pandemics even more swiftly. Thank you.
Thank you very much, Albert. This is great news. I wrote down 2 billion doses in the next 18 months, 1 billion doses this year for low-income countries with non-profit and for middle-income countries with low cost. This is great news. Thank you very much for that. So now we are eager to listen to the CEO of Moderna, Stéphane Bancel.
Hello. My name is Stéphane Bancel. I'm the CEO of Moderna. Thank you for the opportunity to address the Global Health Summit today. The team of Moderna in 2021 was able to develop a high-efficacy vaccine with a good safety profile in only 11 months. And the team was made of 800 women and men. We did that because we had a lot of collaboration around the world with many partners in your countries. As I look at the future, I think we have two priorities. The first one is to vaccinate the planet. The second one is to adapt the vaccines to variants so that we can give boosters that are specific to variants. Moderna commitment is the following. In 2021, we are working hard to get around 1 billion doses of supply to the market around the world. What we decided with our board of directors a few weeks ago is to increase that capacity to 3 billion doses of Moderna's mRNA vaccine for 2022. For that, we are already investing billions of dollars to buy new machines, to hire more people by the hundreds, and to secure more raw materials. For the second priority of the variants, we went very quickly back early in Q1 into the clinic for a South Africa strain-specific booster. We recently published the data where we showed that a booster that is specific to the South Africa strain provided very, very strong protection against the new variant of concern. And we are working very closely with your regulator to get this product approved, hopefully, towards September. Two is low-income countries. This is really important for us because we will not be safe until everybody is protected across the world, so the virus has less opportunity to mutate and to hurt people. In 2021, we already have up to 95 million doses of Moderna committed to low and middle-income countries, including with our partnership with COVAX. This is out of a total of 800 million to 1 billion doses. For 2022 already, we have up to 900 million doses committed to the South, including our partnership with COVAX, but also with low-income and middle-income country governments. We are currently in discussions to increase that output, and it's important to know that for 2022, the 3 billion capacity we did not build for the North. With 1 billion capacity at Moderna in 2021, we have enough to give a single-dose booster for the OECD countries. The reason we decided to go to 3 billion doses is we believe the world needs more mRNA vaccines, and we have to contribute, and that is our contribution. What will be wonderful in terms of help from you is to be able to have free ability to export across the world raw materials, free export of finished products, so that we can get the vaccine where they need to be, and we can move as fast as we can to help as many people as we can. I look forward to meeting with many of you, and I wish you a very good meeting. Thank you.
Thank you, Stefan. Thank you very much for your great news, which means that together with Albert Bourla from Pfizer, in 2022, we'll have about 2 billion doses for low-income countries available. And thanks also for the other news you gave us about adapting vaccination for next year. The next speaker is Vice Chairman of the Executive Committee and Chief Scientific Officer at Johnson & Johnson, Paul Stoffels. Paul, equitable access to vaccines is key to end this pandemic. If you can tell us more about it, the floor is yours.
A global pandemic requires a truly global and unprecedented response, and I'm very pleased to meet with the global leaders who are committed to that same goal. COVID-19 has put to the test decades of scientific research into innovative vaccine science and technology, as well as the ability of the global community to work together to make rapid progress against a novel pathogen. We have broken all historical records in vaccine R&D. This was nothing short of miraculous, and yet it wasn't a miracle. It happened because we have invested billions of dollars over the course of several decades into scientific knowledge and technology platforms, allowing us to not only construct brand new vaccines within weeks of receiving the novel coronavirus genetic sequence, but also to begin producing the vaccine at global scale. From the beginning of the pandemic, we have been clear about our strong commitment to enabling global equitable access to the Johnson & Johnson COVID-19 vaccine, including a commitment made last September to allocate up to 500 million vaccine doses to Gavi COVAX. We designed a single-shot vaccine compatible with standard vaccine storage and distribution channels and have focused on a number of critical strategies to enable equitable access. Recognizing the unprecedented challenge the world faced, we committed to a global not-for-profit prize during the emergency use period. Our Phase 3 Ensemble clinical development program has spanned 3 continents as we sought to generate evidence across multiple geographies and populations, with South Africa, for instance, playing a pivotal role in the development of our vaccine. The growing presence of regional COVID-19 variants further underscored the importance of this approach. We have made significant investments in establishing a global vaccine supply network spanning 11 manufacturing sites across 4 continents, including sites in South Africa and India, to increase supply security worldwide and boost manufacturing capacity in emerging economies. Our collaboration with Aspen in South Africa is one example. As a critical partner in our network, they will supply our COVID-19 vaccine to South Africa, the member states of the African Union, and contribute to the global availability of our vaccine. Our partnership with BioE in India is another example of this. We very much welcome these collaborations to advance our commitments to the world. The COVAX facility and the advanced market commitment are essential mechanisms for ensuring that lower-income nations are not left behind. We strongly support the mission of COVAX, and we are pleased to announce that we have entered into an agreement with Gavi with the goal to supply up to 200 million doses to COVAX by the end of 2021. And we'll stay in close discussion with Gavi on the potential supply of an additional 300 million doses in 2022 for a combined total of up to 500 million doses. No one is safe from COVID-19 until everyone is protected. And our partnership with Gavi is the single greatest step we have taken to ensure our single-shot vaccine is accessible to everyone, everywhere. I'd like to thank all our partners, including many of the governments represented here today, for the groundbreaking work they are doing to ensure that no one is left behind. Having access to a life-saving vaccine shouldn't depend on where you live or whether you're rich or poor. And I'm proud that Johnson & Johnson will play its part in our shared goal of equitable access to end this pandemic. Thank you.
Thank you very much, Paul, for your tireless work, and thank you very much for the generous pledge. You just announced another 200 million doses for Gavi and your strong support for COVAX. Thank you very much for that. And from our part now, many thanks to all the participants in the pre-summit. Thank you very much for your knowledge, for your dedication. Thank you very much for your legitimate calls on leaders of G20. And thank you very much for your pledges. We will now take a short break, and then we will reconvene at 1:30 p.m. with the leaders. Thank you so much.
Thank you.